This will summarize the article clinical and imaging findings in dogs with nerve root signature associated with cervical intervertebral disc herniation. Going through the introduction, intervertebral disc herniation, IVDH, is a common neurological disorder in dogs. In about 15% of cases, the cervical spine is involved. Research shows that 1/4 to 1/2 of dogs treated surgically for cervical IVDH have nerve root signature, NRS, which indicates pain resulting from spinal nerve or nerve root, entrapment or irritation. Although most commonly present with IVDH, NRS can occur with other conditions, including trauma, bony proliferative changes, inflammatory or degenerative disease, and neoplasia. Although the pathophysiology of NRS is unknown, compression, inflammation, and vascular compromise to the sensitive nerve roots may cause this condition. In humans, cervical radiculopathy is a similar condition associated with cervical disc disease. NRS in dogs is commonly associated with cervical intumescence, C6, T2 spinal cord segments, which innervate the thoracic limb muscles. However, there have been no studies to evaluate the clinical presentation of dogs with NRS. This research aims to assess the clinical and imaging findings of dogs with NRS associated with cervical IVDH retrospectively. The study hypothesizes that NRS is more common with disc herniations in the cervical intumescence, occurs more when disc material extrudes or protrudes laterally, and also with disease involving the cranial cervical spine. Going through the methods, medical records of dogs diagnosed with cervical intervertebral disc herniation, IVDH, and clinical signs of non-ambulatory tetraparesis NRS at NC State Veterinary Hospital from January 1, 2010 through June 1, 2020 were reviewed. The inclusion criteria for the study were MRI-confirmed cervical IVDH and NRS identified during physical examination or reported in the history obtained from the owner based on the presence of a forelimb flexing to a non-weight-bearing position while standing. Exclusion criteria included any indication of orthopedic disease of the affected limb, cervical spinal pathology aside from IVDH, hydrated nucleus pulposus extrusion or acute non-compressive nucleus pulposus extrusion diagnosed on imaging, and incomplete medical records or diagnostic imaging. Data collected from medical records included age, breed, weight, sex, neuter status, and duration of clinical signs. Magnetic resonance imaging studies were reviewed independently by a veterinary neurology resident and a radiology resident using Unity software. The images were evaluated based on 3 categories, including IVDH location and laterality, spinal cord compression, and foraminal involvement. The site of IVDH was recorded and the largest volume of disc material was recorded in the quadrant left lateral, left medial, right lateral in which it was located. Spinal cord compression was graded on a modified spinal cord compression scale. Images with evidence of spinal cord compression were further categorized based on the severity of compression. Any abnormalities in spinal cord intensity seen on T2 weighted STIR and post-contrast images were recorded. Foraminal involvement was assessed as present or absent, and if present, the location of the extruded disc material within the foramen was assessed as proximal or distal. Impingement of foraminal height was assessed as an indirect marker of nerve root compression. The degree of reduced foraminal height on the affected side was assessed and compared to the contralateral intervertebral foramen and categorized as either high or low degree of compression. For statistics, continuous data were reported as mean and standard deviation SD or median and interquartile range IQR, depending on whether they followed a normal or non-normal distribution. Categorical and ordinal data were reported as frequency of occurrence. To determine agreement statistics for ordinal data, the weighted version of Cohen's kappa with quadratic weights was used. The strength of agreement was classified as poor, fair, moderate, good, or very good near perfect. To summarize the results for the imaging variables, the reviewers' percentage data for the categorical variables were averaged. A binomial test was used for the comparison of variables, including the number of intervertebral disc extrusions cranial or caudal to C5, the location of disc material within the vertebral canal, medial versus lateral, and the presence or absence of foraminal involvement. Capital A. Multinomial test was used to detect significant departure from an even distribution across the 6 cervical intervertebral disc spaces. All statistical analyses were performed using R version 4.2.1, with a significance level of p less than 0.05. Going through the results, the study included 47 dogs that met the inclusion criteria after a medical record search based on key terms, confirmation of cervical IVDH through MRI, and presence of NRS documented in history or on examination. 4 dogs were excluded due to unrelated neurologic or orthopedic diseases. The breeds of the dogs varied, with Dachshund, Beagle, Labrador Retriever, Chihuahua, Bichon Frise, French Bulldog, Maltese, Yorkshire Terrier, and others being included in the study. 61% of the purebred dogs were considered gender dystrophic with a genetic predisposition to IVDH. The dogs had a mean age of 8.7 years and were of different sizes and weight. All dogs showed signs of cervical hyperesthesia, and additional abnormalities identified included ataxia, intermittent lameness, tetraparesis, and tetraplegia. MRI was performed on the cervical spine using different sequences, and 89% of the dogs had evidence of spinal cord or subarachnoid space compression, with no compression noted in 11% of the dogs. Left-sided herniations were reported in 51% of dogs, and right-sided herniations were reported in 49% of the dogs. Disc material was found to be more likely to be located laterally, and dogs were 2.0 times more likely to have disc material compressing the nerve in the intervertebral foramen. Of the dogs with foraminal compression, 87% of them were determined to involve the proximal portion of the nerve root, while 13% of them had distal foraminal compression. The medial quadrant of the spinal canal was more affected than the lateral quadrant. Some dogs had evidence of IVDH at other locations throughout the cervical spine, but these locations were not deemed responsible for the clinical signs. In conclusion, this study analyzed the MRI findings in dogs with cervical IVDH and NRS. The results showed that most dogs had evidence of spinal cord or subarachnoid space compression, and left and right-sided herniations were roughly equally divided. Additionally, the site of disc material was found to be more likely located laterally. The data provides useful knowledge for understanding the pathogenesis of IVDH in dogs and may be beneficial for future clinical studies. Going through the discussion, this study analyzed clinical and imaging findings in dogs with nerve root signature NRS associated with cervical intervertebral disc herniation, IVDH. NRS is caused by compression or inflammation of neural tissue and is associated with nerve root involvement, especially those that contribute to limb innervation. Nerve roots are the most proximal spinal nerves to emerge from the spinal cord, and they are vulnerable to compression because of their location in the rigid vertebral canal and intervertebral foramens. In this study, NRS occurred mostly in dogs with disease at the C6, C7 intervertebral disc site, but it can also occur anywhere along the cervical spine. with over 40% of cases having disease at other disc sites, where the exiting nerves do not directly contribute to limb innervation. The study also revealed that dogs with NRS are more likely to have a herniated disc that is located laterally in the spinal canal or compromises the intervertebral foramen. The study hypothesized that lateral disc herniations would affect nerve roots as they emerge from the spinal cord and vertebral canal, and this seems to be the case as the findings supported the hypothesis that nerve root disease is more likely to lead to NRS. The results also suggest that the prevalence of NRS in the caudal cervical spine is due to the inherent structural and anatomical characteristics of their cervical spine. Furthermore, collapse of the intervertebral disc space, which is common in both humans and animals in association with IVDH, causes compression or irritation of the nerve roots as they exit the intervertebral foramen, which could lead to higher prevalence of NRS. The study suggests that compression or irritation of nerve roots could occur at any location, including within the spinal canal before the nerve exits the foramen, which can cause NRS. However, the absence of standardized imaging protocols, a variety of MRI slice placement among cases, and non-standardized MRI sequences in the routine evaluation of the cervical spine are limitations of the study. Nonetheless, the study findings provide essential information for veterinary practitioners and pet owners when diagnosing and managing dogs with IVDH, especially those with NRS.